Welcome everybody on to today's webinar. This is the second in the series around leading digital transformation in healthcare and sponsored by SSB Research, Customer Attuned and Newland Partners. We've got a great panel today, very excited to hear their views and perspectives on this topic. I'll ask them to introduce themselves in just a moment. Today we're going to be exploring what it takes to be a leader in this digital transformation within healthcare, but also drawing in perspectives from outside the healthcare sector as well. As we go, we will also introduce a little leadership model to maybe help you think about how you show up in leading change. Where your strengths are and maybe which areas you may also need to focus on to help deliver digital change in your settings. And if you do have any questions, please do use the Q&A function, just pop them in, because we'll have time towards the end for some question and answer, which I'm absolutely sure the panelists will be able to share some great perspectives on. So I want to thank Joe and Nadine and Jack for joining us today. They have got some really interesting experience over many years in different roles to bring to this conversation. And I'm just going to ask you briefly just to give us an introduction to the attendees so they know a little bit about you and your experience.
So shall I kick off then, Will? Yep. Good morning, everyone. I'm Jo Deykes. So we're here for the healthcare, but I'm the lady who's bringing in a slightly different perspective from a different industry. So my background is financial services, predominantly in banking and the savings market as well. Had over 20 years experience within that industry and also within the outsourcing industry as well. So I work for an organization called Atos. At the heart of what we deliver is around digital transformation, and this is bringing business processes and technology together to drive the right business outcomes, and very much focused on the end customers as well, and the experience that delivers to the end customers. Worked in several roles throughout my career. So very much at the forefront with operational delivery as well. So, you know, I've breathed the pain of what it's like to be at the heart of the customers and talking to customers and taking them through their experience, program delivery, and worked in sort of commercial management as well. Always through that financial services, as I say, and the outsourcing industry as well. As a person, just the human side, I'm a mother of two. I have 4 grandchildren and love walking. So I have a new puppy recently, a cockapoo, and very lucky not to live too far from the Derbyshire Dales and get myself out walking about, which is really good for the mental health. So that's me briefly. So looking forward to our session this morning.
Brilliant, thanks Joe, and it's always important to have that personal reflection time to absorb what's going on as well, so that's brilliant. Jack, do you want to go next and give us an introduction?
Yeah, of course. Good morning everyone, I'm Jack Wagstaff. I'm the Chief Officer for a partnership of 11 organisations that covers the northwest of Surrey, so it's an area of about 370,000 people, a health economy about £500 million. The partnership's made up of healthcare providers from the NHS, private and voluntary sectors, as well as 4 borough councils and a county authority as well. So it's brought that broad sort of mix of stakeholders together under a formal alliance, a single board, a single way of making decisions, a single way of looking at our collective resources, appetites, and assets, and the ability to hold and do different things around risk and innovation. And essentially, it's how we bring those partnership together to generate the best outcomes for local people across that patch. So it's a really exciting development. It moves us away from the sort of false market and the competitive dynamic across those sectors, and more towards genuine collaboration for for improvement in outcomes. Done some really exciting things recently around forming different sorts of strategic partnerships with different sectors, and I think that's why bringing different perspectives like Joe's and others to this sort of debate is really exciting, because I think we've got a lot to learn from all sorts of industries, and hopefully that breadth of discussion will be thoroughly live this morning.
Brilliant, thanks, Jack. And I think that immersive experience in lots of different partnerships and how to make them work and come alive is really key. And it was certainly a topic on the first conversation as well. So looking forward to hearing more on that. And then Nadine, do you want to talk a little bit about your experience, your background as well?
Yeah, good morning, everybody. Thanks very much. So I'm Nadine Miles. I'm a business studies graduate based in the Midlands, but from Manchester originally. And the first half of my career was spent in banking, in retail, and then I spent a bit of time with Royal Mail. And for those of you that might remember, I was at Royal Mail a very brief period of time when they rebranded themselves to Consignia, just to prove that, and if no one's heard of that, we can see how effective it was. I was working in marketing and operations in Royal Mail, and then about 20 years ago, I joined the NHS. I've worked in various roles in the NHS, in mental health trusts, in secondary care, so hospitals, and also looking after primary care services. And again, my background is very much either marketing or operations delivery. I stepped away from the NHS about 15 years ago and went to work for a Virgin company, which became Virgin Care, and was part of the team that grew Virgin Care to be able to deliver care to hundreds of thousands of patients, and we won contracts over £750 million, which was no mean feat, but as Jack was referring to, the market isn't like that anymore, and the focus is very much from the inside of the NHS out. I now work for a healthcare company in Leicester called Spirit Health, and we run GP services. We have one of the largest growing diabetes education providers in the UK. We also have a diabetes specialist pharmacy, and more recently we have launched our digital healthcare platform, which enables patients to be monitored at home by a clinician in a remote location. So as you can imagine, during the last couple of years we've been exceptionally busy. Away from work, I have got two grown-up boys. One's about to qualify as a pharmacist if he passes his exam, and the other one is in training in the Royal Navy. Whilst I do like walking, I much prefer going out to nice restaurants and eating good food.
Great, thanks Nadine. I'm quite tired just listening to all of that experience you've got, and with the other panelists as well. Very exciting. So I guess my purpose in the next 40 odd minutes is to try and help draw out some insights and some perspectives about how you lead great digital transformation and what your experiences of that have been. So perhaps a really good starting point is to ask you about what the successes you have had and experienced in leading digital transformation. You know, what have been those stories, successes, and maybe even some of the challenges that you have overcome. Yeah, who would like to start with that? Jack, do you want to kick us off?
Yeah, of course. It's, and I think it is inevitably a mixed bag. I think it's, but I think we do have some quite prominent success. So I think the last sort of 2 years of the COVID pandemic has actually accelerated that transformation quite massively. I think we've moved from delivering something like 99.7% of millions of patient contacts from in a face-to-face setting to now doing much closer to sort of 40-50% digitally and virtually. So that's a huge transformation in terms of the medium we use to interact with people. That means we need to bring on a whole range of support and infrastructure. How do we diagnose in different ways? How do we get results and information to flow across the system in different ways? So a lot of that enabling infrastructure put in quite quickly. We've done some pretty significant interoperability work as well, in terms of having shared record systems all across the county. A really big GraphNet development, and we're also going through a whole patient record system transfer with two trusts, which is one of the biggest ones you can do. You've seen some of the sort of quite clever ones come online as well. So we've just brought AI streaming into our dermatology services across the patch, which I think is inevitably going to be something that's going to grow, particularly as demand outstrips supply, and we have to be really intelligent with our decision making and making sure the right people access the right expertise at the right time. So I think that's going to be definitely part of the future. But I think that whole mode to digital service, I think, has been a huge shift here, and some also in primary care in particular. So and we've been hugely successful at in some of those spaces. So I think really over the last 2 years it has gained great pace, and I think colleagues will have seen that across their areas as well.
Great, thanks, Jack, and that's really interesting, because that's something that isn't local. That will have been something felt by everybody, even patients. So really interesting. Nadine, any thoughts from you around successes, the sorts of things that have been successful in the journey you've been on?
Yeah, I can think of something a bit like Jack was saying, particularly around the pandemic, which is when we seem to have seen a massive acceleration of adoption of digital healthcare, and that's brought some obvious benefits, but it's also brought some challenges, because there is now a plethora of options for digital healthcare out there, and there will be some leaders and some followers in that particular market, and I suspect things will take a wee while to settle down. I think, Jack, to your point about interoperability, keeping up with all the different focuses on interoperability and all of the emerging new requirements is the one thing that is going to enable an organisation to be successful. Actually, I say the one thing. I think there are two things. I think that's the interoperability, keeping up with the other tech and making sure that you have that context, particularly in a health economy. But I also think it's about making sure we don't forget that what we're delivering here is clinical care, and to bring the clinical teams on board to make sure that pathway of care is being digitised where digitisation makes sense, and that we are automating it where automation makes sense, but that we also retain that the ability for a clinician to use their super talents and their experience, and they must feel that they are able to do that. And this is not about replacing clinicians, this is about augmenting their journey so that they can potentially see more people or see people at a more appropriate time in their healthcare journey. So yeah, it's making sure that we're talking in all the right language, both technically and clinically.